Welcome to day 8 of the Workers' Compensation Healthcare Provider Bootcamp. My name is Andrea, and I will be your trainer today, helping you cool down in the recovery tent as we learn about today's topic, return to work for healthcare providers and the work status report. Hopefully, you've been working out with this, building your strength and your workers' compensation knowledge in the other sessions that we've had during this session. But now it's time to catch your breath and lock in on the most important goal of getting that injured employee safely back to work. So while you're in the recovery tent, let's start out by looking at our learning objectives. Make sure you take these away with you. We want you to know the benefits of recovering while on the job and reducing medically unnecessary time away from the job. Know how to complete and understand the work status report, and then know the rule that addresses return to work, as well as the work status report form 73. So please note that the information that I provide to you today is accurate as of today, July 6th, 2026, and our goal is to educate you, but ultimately the responsibility falls on you to stay compliant with the Texas Insurance Code, the Labor Code, and the Texas Administrative Code. So if there's ever a conflict that comes up, like a dispute or a complaint, the written statutes, rules, they're always going to prevail over what I say during this presentation. So please keep that in mind as we move forward. So we're going to go over the goals and legislative intent behind return to work statute and rules. And we're going to take a look at the organizations and medical literature that support early return to work and how it helps injured employees. We're going to take a look at treating doctor and other healthcare practitioner roles in our system in the area of returning to injured employees to work. So we want you to understand this role is extremely important, and it's going to help keep everyone on track during recovery after an injury. So we want to definitely take a look at the nuts and bolts about completing a very important form in our system, the work status report, and how you're going to bill for that as well, because we definitely want you to get paid for your work. And we're also going to take a look at an optional form that employers can fill out. That's kind of the sister form to the 73, and that's the DWC 74. So see how they go together? All right, so let's get started with that legislative intent and goals. So in the workers' compensation system in Texas, the overarching goal is to help an injured employee return to work as soon as it's considered safe and medically appropriate by their healthcare provider or practitioner. So that's the individuals who provide that quality care to our injured employees. We want to help remove all the barriers that might be perceived or real by that injured employee so that they can choose to return to work. And hopefully everyone in our system, all of our system participants are facilitating, making it easier for that injured employee to return to their productive roles and return to their lives. So the intent is that the workers' compensation system must encourage the safe and timely return to that productive role in the workplace, provide high quality medical care that's going to support restoration of their physical or psychological condition so that they can, after their injury, get back to their pre-injury earning capacity, or at least they're going to be earning something that matches their skill set and their capabilities after their recovery. So injured employees, they may have, of course, some permanent impairment after an injury, but that doesn't mean they can't work in some capacity. And we do have regulatory structure around returning to work in the Texas workers' compensation system, and that's going to include our goal that injured employees receive that high quality medical care. We have treatment guidelines that will help our providers both on the network side of things as well as the non-network side of things. So our treatment guidelines that are in place are evidence-based medical guidelines. Again, that promoting that high quality treatment that's presumed to be medically necessary in our system. So on the non-network side of things, we use the ODG medical treatment guidelines. And of course, these guidelines are not black and white. It's a framework, again, that are evidence-based, and the treatment there is going to be presumed to be medically necessary. And these are for our healthcare providers to follow as far as the recommended treatment for the conditions and injuries. Also, we have those return to work guidelines for the Texas Workers' Compensation System. And both of these tools, they're commercially available through online subscriptions, both the treatment guidelines and the return to work guidelines. And again, they're not required for treating doctors to have, but the rules say that they should be followed. So obviously, it's a good idea for you to purchase these, but especially the return to work guidelines, they're very helpful as far as giving you specific disability durations. So kind of gives you a framework for the amount of days expected for someone to be off, maybe with transitional or modified duty, and gives you kind of the big picture as far as their workability. Their work activities required by their different positions. But I'm going to show you the MD guidelines here in just a minute and give you more information. And then also another part of our structure are our employers' return to work program. We provide education to employers all across the state of Texas, and we encourage all of our employers to develop a return to work program for their employees so that they can connect them back into the workplace or keep them connected to the workplace, so that those employees can, can just get back as soon as it's medically safe and appropriate. Our employers, they hold the key to those modified duty or maybe a different job, so that injured employee can come back after the injury. So super, super important role in clearing the way for injured employees to come back to their productive roles. And in addition to the education that we provide employers, we also have a return to work page on our division website that has a guide for employers to help them develop their return to work programs. So yes, even, the division, we're part of all of this too. Also, case management can come into the picture, maybe if there is a severe injury or if the injured employee has gone past the number of days that somebody is typically able to recover from that type of injury. And our return to work guidelines, they're going to be able to analyze like the specific job information in comparison to the injury. And that way, insurance carriers, they can see if someone maybe is going past or outside of the recovery, or if it's looking like their recovery is delayed or failing. They may want to assign a case manager to help facilitate the care. Just to, again, everything is geared towards encouraging that injured employee to get back to their lives and their work. So healthcare providers out there, just be aware that case management is part of our system. So you might hear from a case manager, and please work with them. And of course, we don't expect you to do this for free. There are some charges that you can bill if you're treating or a referral doctor and you're participating in the case management. So those charges and guidance for the reimbursement, that would be in our rules chapters 134 and 137. So our support for return to work, there's a lot of occupational medical literature out there. Specifically, I see articles that come across my monitor all the time to see how returning to work or staying at work after an injury is really going to be beneficial to someone's recovery, help them heal better, heal faster, and stay connected to their job. Some doctors in our system are occupational medical doctors, and they may be members of ACOM, the American College of Occupational and Environmental Medicine. Their position statement actually quotes uh, a quote from that says, "A large number of people who, due to medical condition that should normally see results in only a few days of work absence, end up withdrawing from work either permanently or for a prolonged period." So they're really beating the drum about how beneficial it is for someone to either stay at work or return to work during their recovery, as far as it helping them recover faster. Other associations, the International Association of Industrial Accident Boards and Commissions, um, IAIABC, is very important in all of this. They have a ton of literature. The American Medical Association, American Academy of Orthopedic Surgeons, and the list goes on and on. Um, so we see these articles and studies come out all the time. So that medical literature, it identifies the consequences of medically unnecessary lost time. So when an injured employee, if they stay out of work for a reason that's not medically related, their consequences really can add up. First, their mental health. Their, of course, their physical health can suffer, but their mental health too. So another huge consequence might be financial hardship. Workers' compensation isn't going to fully replace their wages. Um, their temporary income benefits is only going to be paying about 70% of the average weekly wage. And that gap can really put a strain on their finances, and stress, of course, can slow down recovery. So a return to work, stay at work program is really going to help ease that burden. Life disruption, there's financial, emotional strain that could lead to fights at home, divorce, weight gain, dropping out of school, falling behind on rent or mortgage. So imagine all of these things piling up on someone that has a work injury. I mean, it could really make it that much harder to recover. Also, social isolation. As humans, we need connection, and losing touch with our coworkers that may be providing, this social security net, social safety net for us, um, and the workplace community in general. Losing touch with all that could really increase anxiety and depression, especially if that's kind of a pre-existing condition. Um, and also their lost benefits, like the longer someone's out, of course, they might stop paying into Social Security and stop earning those credits, or they might stop paying into their 401k, burning through sick time, lose their insurance coverage, and eventually they could lose their job. So the articles, the studies demonstrate the benefit of working during recovery. So, main one being that the injured employees who are able to stay connected to their work, even in a limited capacity, they're going to recover faster than those who stay home full time and don't go back to work. Um, of course, we're talking about only the employees that are released to return to work. So, oftentimes we see restrictions that are set by the healthcare provider. So that's going to help keep this injured worker safe, but also keep their fellow employees safe. It's going to prevent deconditioning. So if they're continuing to get up, get dressed, be part of the group, it's going to, again, keep that physical and mental conditioning in better shape. And if you think about some of the expressions that I've heard that talk about this, I always have in mind motion is lotion, or sitting is the new scrolling, or scrolling is the new smoking, right? So we don't want them sitting at home doom scrolling, just getting worse. Also, it's going to protect their mental health, isolation from their coworkers and their work community that could add stress and dysfunction, again, especially in someone that has pre-existing conditions. And then also keeping their job skills sharp. Today's technology changes all the time. In our workplaces, they can change really fast. So, I mean, think about someone that's in a manufacturing situation. If they're not at work for a period of time, without medical need, of course, um, they could fall behind. So if they're not there practicing their skills and keeping up with what's changing, they could fall behind very fast. And then also protecting their job. So in Texas, employers, they can't fire someone just because they got injured on the job. But if the employee is not able to perform their duties and that employer, they're following their absentee policies, they might need to fill that position because, I mean, they need their business to continue. They need the work to go on. So returning sooner, even just part of the time, that's going to give employees the best chance of keeping their job. So how do you fit in? Treating doctor, and also other healthcare practitioners. Returning an injured employee to work, it's that shared responsibility. So it's going to involve everyone, but treating doctors and other doctors, you are so important. The first thing is we want you, treating doctor, to set the return to work or the stay at work expectations or goals with that injured employee on the very first visit. So it's okay for you to say, let's talk about you returning to work. And this should be something where you're setting expectations with that injured employee. And of course, they may bristle and think, why are you trying to send me back the next day? But that may be too soon, right? But we want you to talk to them in a way that's going to help them understand that returning to work is something being done with them, not something just being done to them, right? So they probably haven't thought through all of the consequences or the benefits that we've talked about. So they may not understand all these consequences of that medically unnecessary lost time. So this is where your MD guidelines could come into play, where you can look at the expected duration of the disability. So you could set those expectations for how long you think that they might be off work, how long they might be having pain, when they could return to work in some sort of capacity. So it's important to measure returning to work as part of the treatment plan, as part of the, to measure those health outcomes. So returning to work should be one of those health outcomes that you measure as one of your medical interventions. So it's a good way for you to ask, are my medical interventions working? Is this person recovering as I thought they might? So again, talking about returning to work, let that be part of a normal exam for the injured employee. Set those expectations on the first visit and talk about it often. You're going to be communicating also with other providers, treating doctor. So communicate regularly with those referral doctors, ancillary providers. If you've sent your injured employee to an orthopedic surgeon or a physical therapist, communicate with them often. Because we need for you both to be on the same page as far as return to work expectations and what that person can and can't do safely. So, treating doctor, you're ultimately responsible for the coordination of care for that injured employee. So make sure that you're staying in touch, not just about their health care, but also about return to work specifically. And then again, incorporate return to work into your treatment plan. So just like you would take out a physical therapy or medication, make a prescription for non-network claims. Look at those disability durations to help guide you with that. So I was talking about non-network claims, but again, networks, they get to choose which return to work guidelines they use. So for non-networks, it's the MD guidelines. For networks, it might be something else. And although it's not finalized yet, the division is in the process of a rule revision to transition to using the official disability guides, the ODG, for return to work durations. Hopefully, we want to have this in place by October 1st of 2026. But currently, we're using the MD guidelines. So this is a commercially available product. So it does cost money. You need a subscription. but the rules do say that you should use the return to work guidelines for evaluation and of the expected and average return to work timeframes. So you can find the MD guidelines on this web page. And just keep in mind, it's not a requirement to purchase these unless you're a designated doctor in our system. But again, it's like operating in the dark when you don't have what we consider to be the scientifically valid, evidence-based guidelines for return to work. So I'm going to pull these up right now for you and just give you a super quick overview of the MD guidelines. And you should be able to see the MD guides. All right. So whenever you log into the MD guidelines, this is what you see on your dashboard. And what we're going to pay attention to is durations here. So if I click into durations, it's going to give me a prompt to where I can enter a keyword, ICD-9 code, procedure code, anything like that. So I'm going to just say low back pain. And I'm going to search that. And here I have low back pain unspecified. So I'm going to go ahead and click that. And it comes up with these duration estimates. And so return to activity estimates in days. And you'll notice over here, we have the average, early return to work, and then expected durations. And then, of course, we have where you'd want to evaluate, and we have an outliers. You notice it has a bubble that comes up, and it gives you general information. So the point in time when additional case information should be requested to determine if or when the individual may be returned to activity. So that's on these. So this will be for most people. Something else I want to point to is the activity level. So maybe this person is an administrative person. So it gives you your return to work estimates here. If you adjust this, it'll adjust as well. And then if you come over here, maybe we have someone who works in construction and it's not cooperating. There we go. So we could go up, someone that has a very heavy activity or physical requirements. If you adjust it here, again, it goes up here. So that is very helpful. Also, there's other analytics that you can add, their age, their activity level, program, industry. So it gives you a lot of ways that you can adjust this to estimate their returning to work, and then also, you know, to guide those conversations that you're having with the injured employee. So I just wanted to show you that real quick. And again, you can find out more information by going to the website for MD guidelines, or you could call them. And again, I just wanted to point out one more time, keep your eye out, because we are most likely going to be transitioning to the ODG for these return to work durations, hopefully by October 1st. So of course there'll be training and a lot of additional information coming out on that. So back to the treating doctor's role. Treating doctors, there of course may be factors that are non-medical that are going to interfere with successful treatment. So if you know that treating doctors, of course, you can't control all of the things that are going on with that injured employee. But if you're aware that you're, and keep in mind that you're treating a whole person, you're not just treating their job title, you're not just treating, truck driver, period. But this is a whole person. So of course there may be social issues, family issues. Gosh, maybe even they can't get a ride to physical therapy, or maybe there's other things going on at home that are preventing them from uh, taking part in their treatment. So just be aware that those things may interfere and cause that delayed or failed recovery. Um, Encourage the injured employee to take an active role and to be open, and communicate with you. Like, some people are very quiet, or passive, and they may not realize that they can communicate with you and tell you um, what they, what's going on with them, or what they can and can't do back at the workplace. So taking an active role in their recovery, is going to help them, because if they're empowered, they can understand what's going on, and they can make that decision to go back to work. And they can know that you're going to do everything in your power to help them get there. Um, so also, they may not understand that pain doesn't always mean that they can't be active or working. So I remember back in the day when I was involved in workers' compensation, if somebody had a back injury, they would just be told, go lay down, go rest. But you do that for a long time, that's going to make it worse. And we know that now. We know that movement, in a measured, progressive way, is going to help our injured employees stay active and get back to their lives. So, treating doctors, your job as a healthcare practitioner is to assess the injured employee's abilities in relation to their functions and their tasks. So, not just their job title. They're not just a truck driver. Um, you do your job, and then you let the employer worry about the job offers, not you. So your task is not to say, yes, they can be a truck driver again, but we need you to say what they can and can't do safely, right? If they can't drive a truck, what else can they do? Can they sit at a desk, answer emails? Can they do dispatch duties? Could they maybe do some light work uh, in other areas of the facility? So instead of driving, think about the functions and the duties. Can they do anything? Um, so give the employer information about what they can and can't do. That is so important, and that's your role. And then the employer, they can make decisions about transitional duty. So identify and focus on what they can do physically, and definitely stay positive with the injured employee. We want to talk about what they can do as much or more than what they can't do. So I've talked to injured employers across the state again, and I tell them, if they have any questions about what the injured employee can or can't do, contact the doctor, right? Be transparent. Let the injured employee know that you're going to be calling the doctor, because you want to understand. You want to keep this trained, experienced person in the workplace. So, doctors, please talk to the employers if they call you. And then if you're taking someone off work just because they can't perform the exact job that they had, or you hear from the injured employee that, oh, the employer, they don't want me back, until I'm 100%. We need you to kind of set that aside, right? Your job, again, identify what they can do safely, and then let the employer do their job and make those employment opportunities available for that person. All right. So let's get into the 73 form, the work status report. And this is where you're going to be spelling out what the injured employee's work abilities actually are. And there's a big misconception that people think maybe you can't release this person back to work until they hit maximum medical improvement, right? MMI. So that's the date that you may assign, saying this person's as good as they're going to get. There's no more material recovery expected for this injury. And the mistake is thinking that there's nothing that that employee can do at work until they hit that point. But don't let MMI drive how you're filling out that 73. Almost every injured employee can recover while they're still on the job. So you can absolutely release someone before they reach MMI. And it may work on the flip side too. Even after someone reaches maximum medical improvement, they may still need restrictions, or maybe they're not able to go back to the same position that they had. So, the misconceptions could run on both ways, but don't let it box you in. Because again, at the end of the day, your job is to figure out what this person can and can't do physically. And to do that, we talk to everyone else involved, physical therapist, referral doctor, whoever's in the mix, but get on the same page about what this person can physically handle. Because if you're not talking to each other and if you're not aligned on restrictions, you might end up with competing work status reports. And then the injured employee gets confused, and now you've potentially created a dispute that didn't need to happen. So please realize what a huge part of this puzzle that you are, and stay in communication with everyone, and then release that employee to work as soon as it's medically appropriate. And then from there, the employer is going to take it from there and make those appropriate work opportunities available. And then something super important to understand: if the employer doesn't have exactly the same job or only has part-time, that is not going to impact this person, the injured employee's eligibility for income benefits. They could still be taken care of. Temporary income benefits are going to be adjusted depending on how much they're earning. So if they're working half of their regular hours and only earning half of their average weekly wage, those temporary income benefits, they could go up or they could go down if they start earning more at work. So the injured employee, they're going to be entitled to those temporary income benefits to compensate for lost wages until they reach maximum medical improvement. And then after they reach maximum medical improvement, there could be some other income benefits that they're entitled to. So again, collaboration between the treating doctor and the injured employee on setting those return to work goals is huge, but it's not just the two of them. Referral doctors, ancillary care providers, your role is just as big. The orthopedist, the neurologist, the surgeon, everybody needs to work alongside the treating doctor to help shape those return to work goals. The physical therapist especially could add so much valuable information. Like if you think about how much time the physical therapist is spending with that injured employee, they can really dig into what they can and can't do physically. So make sure that you're communicating with them, help them lean into the positive framing too, because that physical therapist or the occupational therapist, they can reinforce that this person is going to recover faster if they get back to work in some capacity. So as soon as it's medically safe and appropriate, of course. And again, this is something being done with the injured employee, not just something being done to them. And that message needs to be consistent no matter who's saying it, whether it's a treating doctor or a referral doctor. So really, you're coordinating with that injured employee's whole healthcare plan and work status together with the treating doctor. Also, the referral doctors, they have a responsibility to submit their own work status report whenever it's one of the situations that are required by rule. And we'll go over those. But first, I want to go over completing and billing for the work status report, the DWC Form-073. And what is the 73? It is a communication tool. Yes, you're going to be documenting what this person can and can't do safely, but also it's something that you could put in front of the injured employee, your patient, and help guide a discussion about what they can and can't do. And it's necessary because the treating doctor can use that 73 to help the injured employee understand that those return to work or stay at work goals, what they can and can't do, and then use it to encourage the injured employee to discuss options for working. So the employer, they're going to use this information to discuss, to determine what work assignments they have. So maybe it's completely a new task, part of their regular job, or switching job functions with another employee for a little while. So the insurance carrier, they can use this information to accurately pay those temporary income benefits and determine whatever course of action they need to take as well. So when is the 73 required? When is it submitted? A 73, it should be submitted when it's required on the very first visit. Again, establishing early return to work goals is important on the very first visit, unless they're in the emergency room, of course. If you're the doctor, the treating doctor, referral doctor, if you're seeing this patient for the first time for that injury, fill one out. You need to fill out a DWC 73, and that includes any delegated physician's assistant or maybe an advanced practice registered nurse that you have that's seeing them for the first time. They need to fill out the work status report, and they're allowed to complete it if they're the ones seeing the patient on the very first visit. After that, anytime activity restrictions change substantially, and we'll get into that definition here in a minute, or maybe they can go back to work on a part-time basis after not being able to. That would be a substantial change or a change in their work status. Complete another 73. And then sometimes the insurance carrier, they want a 73 and they can request that and you could fill it out, but it must be based on scheduled appointments that you have with this person. So it needs to be associated with an exam and based on scheduled appointments, and also not more than once every 2 weeks. So the intent behind that, we don't want this person to have to be going back and back every few days just to get a new, quote unquote work release. So if the insurance carrier is requesting it, use the conditions when you complete one and make sure that you're familiar with the rule. And then on this, notice on the slide, it doesn't say that they need a 73 work status report for after every visit. And of course, that might be the case if things keep changing, but that would probably be rare. So just keep in mind on the first visit, when anything changes or upon the request of the insurance carrier, bottom line, we need to receive one of these whenever the rule requires it. And then that's when you can bill for it. And that's when you'll get paid for it. So specifically, what does a change of work status mean? A change in work status means one of 3 things. Number 1, the injured employee is allowed to return to work without restrictions. And remember, that's not the same thing as MMI, maximum medical improvement. Okay. Number 2, it's when the injured employee may go back to work with some restrictions. Maybe they can work a limited number of hours. Maybe they can work only sitting. Maybe they can work only standing, or they don't have any climbing or reaching duties. So just depending things like that. And then number 3, it's when the compensable or the payable injury prevents the injured employee from returning to work at all. So those are our 3 work status choices. And then the definition for substantial change in activity restrictions, that means from the last 73. Maybe they were only able to lift 10 pounds and now they can lift 20. Or maybe it prevents them from working when they were able to before. For example, maybe they had an arm wound that opened up and now they can't reach now. So anything substantial, anything that changes with their activities that they're able to do, more or less restrictions, maybe they have an expanded ability to function. So again, that's when you can complete another 73. And then who gets the form? It is super, super important to discuss this with the injured employee at the time of the examination. If you happen to be doing telemedicine, You could electronically deliver it to the injured employee. But again, please don't just hand it over and let them figure it out. Please try to make sure that they understand what you're putting on there. Um, this should be a discussion with them. And again, it's empowering them to participate in that discussion and maybe participate in the discussion with their employer, and then determine their abilities and keep progressing forward. So definitely give the injured employee a copy. And also the employer, it's extremely important that they get this form not later than the end of the second working day after the exam. I did not say calendar day, so working day after the exam. And you could also send it to them electronically. Um, but the most important thing is that they need to understand what it's saying, because they're going to be making those work opportunities available for that person based on what you're telling them. So not only keeping the injured employee safe, but all of the, their team members as well. So make sure that they get the form. Also, it's going to go to the insurance carrier. Again, not later than the end of the second working day after the date of the exam. And again, you can send it to them electronically as well. And the carrier, of course, they need this because they're going to be monitoring any changes in the work status. So that way they can make sure that they're accurately and timely paying the benefits to the injured employee, anything that's due to them. And then now we're going to go over the actual reports and what it looks like. So this is the top of the work status report. This is an example of a 73 where the injured employee is released without restrictions. So this is where the healthcare practitioner is checked 13A, and it says that they're allowed to return to work, and it's going to give a date that they're available to return to work without restrictions. So up top is the demographic information, and who is filling out the form. And then in box 4, you'll see this is a description. It says the employee's description of the injury or accident. So it doesn't say put it in your words. It says, what does the employee say happened? And it needs to be in their words. So please keep that in mind. It needs to be the employee's accident description, like what happened that caused this injury to them. And then in section 2, this is where you put the work status information. And then again, 13A is where they are able to be released without restrictions. If you want a copy of this form, a blank one, you can find that on the DWC website. And if you go to the workers' compensation tab and then scroll down to workers' compensation A through Z, click on F for forms, you can find the work status report DWC 73, and it'll have the first page of the form that you would fill out, but also it has the instructions. And sometimes those can be really helpful. So if you have a copy of the form and don't have the instructions, definitely go to our website and you can have access to those as well. All right, so this next example is where the employee has been released to work with restrictions. Okay, it's going to give a date range from and to date, and then it's going to list the restrictions that they have further down the page. So we were up in sections 1 and 2, and this is section 3. And you can see here it has maximum number of hours that they are released to do certain postures, certain motion restrictions, any miscellaneous restrictions, like maybe they have to use crutches or maybe they have to take a stretch break, things like that. So this is such a great communication tool because it can be very specific, and the clinician should be filling this out discussing it with the employer so that they can take over and again make those employment opportunities that match these. And hopefully, again, it's going to help resolve confusion, maybe remove barriers around helping that person decide to go back to work when they know what to expect. Something else important down here, block 16, this is a free text field where if the sections up more towards the top don't cover all of the restrictions that you have, or if you have anything else that needs to be communicated to the employer, definitely fill this out, right? Put your own words in there. And then section 20 is very important, especially if they're taking medication. The employer may need to know that so that they can know whether or not to make sure that they're not doing anything risky while they're taking medication that might make them drowsy or something. So super, super important. And then next, this is an example of where the employee is not able to work at all. So the provider would have checked section 13C, block 13C. So 13C is a little different. It's going to also give a date that this person cannot work at all, but it should also have a continued date. So you're going to have that date range. But then underneath it, it's going to have this free text field where you can tell us exactly why medically this person cannot work at all, cannot do anything at all. So if you see in this example, it says pain. Or if you, sometimes we see the employer doesn't have a job for them. That's not a medical reason. So we've heard that unnecessary medical time can be as high as 60 to 80% of workers' compensation claims. So all of that is time away that's not due to a medical reason. So we definitely need to identify, remove those barriers so that someone could go back. So again, if you're typing in a reason in 13C, it needs to be a medical or psychological reason. And tell everyone why this person can't return to the workplace in any capacity. If you're just putting pain in there, that is not a sufficient explanation. What we've been seeing a little bit more frequently is that the injured employee, they're waiting on a procedure from the referral doctor. Well, that's something that they need to work out with the referral doctor. They need to work out whether this person can do anything back at the workplace. Like they're waiting on an epidural steroid injection or a surgery or an MRI. So that's not a sufficient explanation. Waiting isn't a sufficient explanation. So please make it a medical reason. It may be the thing that's preventing them from returning to work at all, but you need to tell us more. And then we do monitor this in our system. So if you're checking off 13C, pay attention to that and help yourself avoid trouble, because we're tasked with doing performance-based oversight audits of medical providers, and DWC 73s are randomly selected. And currently about 60% of these forms that are audited don't have an acceptable description. And so the division, we have to pay attention to that. So here is an example of a very clear explanation why this person couldn't work at all during recovery. It says they can't work for, it looks like about 4 weeks, persistent abrasion, they're healing, their ulceration to the right lower leg, and they're on antibiotics for infection confinement to minimize the risk to the injured employee as well as their coworkers. So that is very clear, very clear. So the last section that we're going to talk about is the follow-up section on the work status report. And this is letting everyone know, are they coming back for more appointments? This is going to help the employer know that information, then coordinate with their employee when they have to maybe go back for more appointments, or if they have a referral or maybe even a consultation on the books. So also if they're receiving physical therapy, um, right here, all of these things can be indicated. And um, also, if this is the last scheduled visit for this person, you could check that as well. And that's going to let everyone know not to expect any additional medical care. And then you might get a call asking for a DWC 69, which is the report of medical evaluation. And that may be because the carrier, the insurance company, is looking for information about that last scheduled visit. Is everything kind of wrapping up? So if you use that section, you could send this work status report um, to the carrier and let them know that that was the last official visit. So again, it's a communication tool. And all of these fields is going to allow you to communicate what the predicted or expected follow-up services are. And again, uh, APRNs, physician's assistants, they can complete these forms if they're properly delegated by the treating doctor. Those mid-levels definitely could fill out the forms. All right, so billing for the work status report is going to be covered by Rule 129.5, and it's going to address all the things that I've gone over so far and tell you when you can and how you can bill for the work status report. So remember, first visit, if anything changes, and when the insurance carrier requests, then generally you can bill for the work status report, and you'd want to use CPT code 99080 and then use modifier 73, and the reimbursement value is $15. And the insurance carrier reimbursement is only due if you're following the rules. So if they keep asking and you keep giving them, you might not get paid. And if you're billing for a 73 on every single visit, that may or may not be required by rule. So follow the rule for it to be justified and reimbursed, because we do want you to get paid for your hard work. And then one other form that I wanted to tell you about and touch on that is really going to help communicate between the employer and the healthcare provider. If you're a treating doctor talking to an employer, trying to determine what, to indicate that they could do safely back at the job, and your injured employee is in front of you saying that they don't really remember, or for whatever reason they don't know what they do. Maybe they're in shock. They just got injured. The employer, they could fill out this DWC 74 form. It's the employer's explanation of injured employee's job, and it could go to you and help explain exactly what they do back on their work. So it's not required for the employer to fill this out, but we do educate all of our employers across Texas that it's out there for them, and have it ready to send with the injured employee when they go for that first visit. Of course, they can always send it later, but as long as you could see this form, it could really help you make better decisions about what the injured employee can and can't do as far as their job functions, duties, specific tasks, and work activities. So this is the form, and high level view, you see it looks almost identical to the 73. That's why we call it the sister form to the 73. And very up close, we want to show you that it's kind of apples to apples for the healthcare practitioner filling out the 73. This information would come directly from the employer. So they would tell you, during their job, they can only bend or stoop for less than 2 hours a day, or they could only walk for 2 hours a day, or grasp and squeeze for 1 hour a day. So all of these details are extremely important, can definitely help you out. And do the employers have to fill this out? No, they don't, but we definitely encourage them to. So providers, your employers too. So you could use this. and fill it out for your employees ahead of time, like before that injury. That way you're not scrambling, after an injury happens. So we definitely encourage using this as a great tool. And one last thing, if you're a healthcare provider and there's been some changes in the injured employee's functional ability, like maybe they have some permanent impairment, or maybe that they did lose their job, the Texas Workforce Commission offers free vocational rehab services to injured employees in Texas. That might help them prepare for or get another job that matches their new abilities. So you could refer that injured employee over to the Voc Rehab section of the Texas Workforce Commission, and their contact information is here for you. And they'll be happy to work with the injured employee about getting back to some sort of job, and helping their health in general. And the Division of Workers' Compensation has a list of injured employees that have been off for more than 12 weeks that we share with the Texas Workforce Commission, so that they will purposely reach out and help those injured employees. Also, injured employees, they could self-refer. And even if they haven't been off work for 12 weeks, or they don't have a specific diagnosis or condition, anyone could use the Texas Workforce Commission Voc Rehab services for eligible adults with disabilities that'll help them get back in the workforce. So it's a great tool to know about. And just keep in mind, there's studies out there that show if an injured employee has been off work for 6 months, the possibility of them returning to work, whether it's for the same employer or any employer, is less than 50%. So we really want to educate our healthcare practitioners, our employers, our injured employees, that the sooner that they get back to work, the better and faster they're going to heal. All right, so let's review what we talked about today. We went over the goals of the Texas workers' compensation system, the legislative intent behind returning someone to work. We went over the medical literature that supports returning to work and staying at work after an injury, and then what the roles are for treating doctors and other healthcare practitioners, mid-level practitioners, referral doctors, in completing that work status report, the DWC 73. We did go over the form, the work status report, and remembering it's not required, but we went over that optional form that employers could fill out and offer a lot of assistance to our healthcare providers. So now we are going to flex your knowledge, and hopefully you have gained a lot of information from this workout today. And I am going to post 5 questions. Let's go over these questions. Question 1, a main goal of the Texas workers' compensation system is to help injured employees get back to work as soon as their doctor says it's safe and appropriate to do so. 100%. I am so very happy everyone got that right. And then question 2, promoting a safe and timely return of injured employees to productive roles in the workforce includes case management, employer return to work programs, treatment and return to work guidelines, all of the above. Almost everyone got that right. Excellent. Thank you so much. That's correct. And then another 100% got this right, that return to work discussions should happen early and continue regularly to minimize bartering between the injured employee and the treating doctor later. And there's less surprise, potential conflict. Absolutely. If you address this early on, you can prevent a lot of conflict and discussions and disputes. All right. Question 4, the treating doctor should communicate regularly with the referral and ancillary healthcare providers about the injured employee's care and return to work expectations. 100%. Y'all are on a roll. I'm so proud. Yay. And then who gets the DWC 73 form? All right. So this one, we had almost 90% get it right. And it is all of the above. The injured employee gets it. Yes, definitely. The insurance carrier gets it. Yes, definitely. The employer gets it 100%. Absolutely, yes, the employer needs it because they hold the key to offering this person work opportunities. So definitely, everyone needs it, right? The carrier needs it because they need to pay benefits correctly. The injured employee needs it because they need to know what's going on. Uh, and then the employer, so, so important. Thank you so much for participating in that. After reflecting on this webinar and then any others in the bootcamp series that you attended, uh, you may come up with some questions, or maybe you have a situation that came up. You can always reach out to us at Comp Connection with your questions. And our phone number is 1-800-252-7031. Please be sure and choose option 3. That way you'll come directly to us. And then you can always reach out to us 24 hours a day at compconnection@tdi.texas.gov. Thank you so much for your time today.